Hi, everyone. My name is Jen Tomassi, and I'm Vice President of Client Success for Sterling Healthcare and Life Sciences. I'll be hosting today's panel conversation, and with me today, I have the amazing Stanford Health Talent Acquisition Leadership Team who will join me in discussing the topic about combating the employee shortage in healthcare. With 20% of U.S. hospitals reporting critical staffing shortages and staff turnover due to COVID, pressure is very high for organizations to fill positions quickly and effectively. Today, our discussion will be centered on this topic, and we hope to answer the following questions for you. One being, what new and creative strategies can be used to source and increase your talent pools? And two, what are the tactics to deliver a stronger and faster candidate experience? So please allow me just a moment to introduce Sterling. I'm sure many of you joining are aware of who we are as an organization, but for those who are less familiar, I want to share with you that we're a global leader in background screening and identity services, and we truly are a mission and values-driven organization. We promote environments that are based on trust and safety so that you as our customer can protect and serve your employees, patients, residents, customers, and partners around the world. And as I mentioned, we're global. We have 22 offices in 9 countries, and we're organized actually by industry so that our clients can capitalize on having that large scale and infrastructure and financial strength of a large company, but while getting a boutique feel through our client service model and the expertise we bring through our industry expertise. Joining me today from the Sterling team is Angelina Duritis. She will be flying co-pilot with me today and helping me through question and answers. So to that end, you can use the chat box to submit any questions you have. We'll do our best to answer them fluidly throughout the webinar. So if your question is relevant to a specific topic, we'll try to address it at that time. And Angelina, thank you for joining me today to help me with that. I also want to make you aware, our audience, you are eligible for SHRM professional credit. So we will be providing you with information following this webinar so that you can effectively activate those credits. And so now, please allow me to introduce the Stanford Talent Acquisition Leadership Team. I will start with John Higgins and then allow John to introduce his team. John is a dear partner and client. He is a Senior Director of Talent Acquisition at Stanford Health. He has 25 years of HR and talent acquisition experience, and at Stanford, he leads a team of over 180 talent acquisition professionals who provide recruiting, sourcing, talent strategy, and agency support services to a health system that spans 24 states. So John, I'll hand it over to you to introduce your organization and your team.
Thank you, Jen. I appreciate it. Good afternoon, everybody. I'll start real quickly with a quick overview of Stanford to just kind of set the stage. Many of you may not be familiar with us, depending upon what area of the country you're in. Stanford Health is one of the largest health systems in the country. We're headquartered in Sioux Falls, South Dakota. We have 46 medical centers, over 200 clinics, 200 plus senior living communities, 150 plus skilled nursing and rehab facilities, 42 affordable housing locations. We employ about 48,000 people, of which approximately 1,500 are physicians, 1,200 advanced practice practitioners, providers, and 8,700 registered nurses supplying care in over 80 different specialty areas. Ultimately, our vision as a health system is to be the premier rural healthcare provider. With over 80% of the country classified as rural, we know there's a massive opportunity to create a better care model to better serve those that choose not to live in major metropolitan areas. So it gives you a little bit of background on who we are as an organization. Real quickly, I'll just touch on each of my team members that are here to help answer questions. You'll quickly recognize that I'm surrounded by people that are far smarter than I am. Michael Olson is our Director of Talent Acquisition Strategy. He oversees not only TA strategy, but a lot of our agency initiatives and provides senior leadership to our sourcing team as well. Amanda Beeler is accountable for our TA operations team, which ultimately manages all the kind of front-end processing for getting people through our interview process, getting them scheduled, that type of thing, and then it handles all of our onboarding, pre-boarding activities. And she's also a key person that handles a lot of our process improvement work, in addition to some of our key programs, oversees our internship program, our fellowship programs, things like that. Jenna Klepitz oversees our senior care recruiting operation. So I mentioned earlier, we have over 200 senior living communities, about 10,000. We hire about 10,000 people into that organization every year. Jenna is accountable for that activity. Courtney Sneller oversees our sourcing function. So her team is accountable for making sure that our applicant flow is strong and that we've got good flow of talent coming through. I'm sure she'll be leaned on during today's conversation. John Gehring oversees our non-clinical recruiting for our traditional if you will, inpatient and ambulatory businesses. So non-clinical, all of our executive recruiting in corp services as well. And last, but certainly not least, Lynn Halverson, who, by the way, is just celebrating 19 years here at Sanford. I should acknowledge that. Lynn oversees all of our clinical recruiting. So think nursing, allied, those types of things as well.
Thanks, John. 19 years is very impressive, Lynn. Congratulations. Thank you to the whole Sanford team for being here with me today and taking time out of your schedule and spending it with this audience who is all interested in understanding the ways in which you all have combated the staffing shortage, at least to the best of your ability, right? So I'd like to maybe start the conversation off just by grounding us in the problem, and then we can get into actual strategies in terms of how you're working through solving the problem. So, you know, the pandemic has led to burnout and increased turnover, we all know, and the staffing shortage is not a problem I think any of us expect to go away soon in relation to the pandemic ending. This problem also is one that the healthcare industry faced long before COVID-19, but it's really only been exacerbated through the time period of COVID-19. In fact, an analysis conducted by Mercer found that there will be a critical shortage of 3.2 million healthcare workers by 2026, namely in hospital and health systems. So with all of that being said, could I just ask any one of you, and feel free for multiple to chime in, but if you could just talk us through the staffing shortage problem as it relates to what you're seeing at Sanford, and just give a name to this problem, that will be a good grounding place to start.
Yeah, Michael, I might lean on you just to kind of lean on this one to start.
Yeah, sure. Yeah, so what we see kind of in the healthcare space and in our industry is, you know, especially since the pandemic hit, a lower than typical applicant volume. Our applicant volume certainly dipped over the last few years. There's been some positions that become harder and harder to fill. The pipelines that were previously built in some of the college recruiting that we've done have diminished because not as many people are going to college for the same types of roles. And then ultimately, I would say the other thing that's impacting us in healthcare uniquely in relation to the rest of the labor shortage is that our financial models don't change because of the labor shortage, right? So as other industries are able to raise their prices or adjust their hours of operation, for example, to be able to deal with their staffing crisis, we don't get that luxury. We are a 24/7 business. We need our staff there, and ultimately, we don't have the flexibility since a large portion of our income stream is tied to various payment models, including the government and insurance companies, to adjust our prices on the fly, to adjust our wages, to be able to recruit people differently. I was actually just talking to somebody that I know who works in the hotel space, and they said, we don't feel the same pressure as you because if we don't open our restaurant until 5 o'clock that night, then we don't open the restaurant. It's not that big of a deal. Versus in healthcare, people's lives are on the line.
Okay. Anybody else want to jump in before I move on? Okay. So sticking with what you were saying there for a minute, Michael, before the financial disparity, could you comment maybe on where you're seeing a disparity in terms of supply and demand with roles to fill? Like, where do you see, or to anyone on the Sanford team, where do you see the biggest gap in terms of the labor shortage?
Yeah, I can get us started. So, I mean, we've always had those difficult to fill jobs in healthcare. Nursing shortage is not a new storyline that's out in the marketplace. Some of the allied health professional jobs are and always have been difficult to fill. I think the things that have shifted most recently are some of those entry level roles that previously we never had them filled per se, but now the gap is getting wider and wider and wider, and we're experiencing new pains that we have not experienced before. But anybody else want to add on to that?
Yeah, let me jump on, right, because it's certainly in the nursing space, and Lynn, you can probably comment to this as even better than I can. But the fact is, we've certainly seen a great number of individuals choose to travel instead of work in the traditional kind of employment model, if you will. And as such, that's caused some significant shortages. We've also seen, obviously, a significant wave of increase in retirements amongst nurses as well. So that's created some really difficult gaps in our nursing space. And then to Michael's point, the entry level, some of our frontline, non-clinical roles even are where we have some of our biggest challenges. And John, you certainly could probably comment on that as well. So anything else, Lynn or John, you guys want to add to that?
Yeah, I think we're seeing the shift with allied going to traveling as well. So it's not necessarily unique to nursing. And I think the other thing that we're seeing more of is more competition with non-healthcare. So wages and flexibility and all of those things are certainly front and center for us as we have conversations, but certainly seeing that with our candidates and employees as well.
And to Michael's point, the competition that's out there right now in the non-clinical space vying for our candidates for entry-level position have the ability to offer whatever they can offer. I mean, they're a for-profit organization, and it's just getting more and more challenging to attract that talent.
So we're going to come back to, I think, the point that you're all touching on, which is sourcing talent is difficult, and especially amongst the competitive pressures of other companies and industries. Before we circle back around to that in our next section, do you see the impact of the staffing shortage, these trends? Do you see them? Have they changed? Actually, I'll say, have they changed the way you bring care to patients? A question along the lines of organizational strategy for a moment there.
Yeah, so one thing I'd touch on, right, is I mentioned our focus on wanting to be a premier rural healthcare provider. And one of the key things that we're moving and advancing significantly more and more is in the virtual care space, right? How do we get the best specialists in front of our patients where they live, right? How do we care for them in the middle of rural America without having to make them drive into the big city to get that care? How can they get the diagnostics remotely? How can they get the care in the treatments remotely without having to drive into a major metropolitan area to make that happen? Because quite frankly, a lot of them don't want to. So I think that's one of the key ways. I'm sure if there's other thoughts on the phone or that others might have, that would be great to add in on top of that.
Okay. So let's transition here to a polling question. This will get us flowing into our next section, which is actually addressing some creative strategies to address the problem. But first, let's poll our audience to understand what aspects of the talent management lifecycle you find to be the most challenging in the context of today's environment around the labor shortage. So I'll talk out loud about the options you have here, but feel free to click the bubble that that applies to you, and I'll give you about 10 to 15 seconds to respond. So sourcing talent, that option being specific to finding the volume of candidates to keep talent pipelines full and flowing. The interview process being more about ensuring the process moves quickly enough and hiring managers make swift decisions. And then finally, pre-boarding, specific to managing the activities that happen in between the time an offer is accepted by your talent to day one when they start, right? So they move through that process quickly and you avoid dropout. So I'll just give you a few more seconds to respond, and then we'll go ahead and close the poll. All right, Angelina, if you want to go ahead and close the poll, if it looks like we've got enough responses, we can do that. And no surprise here, it's very heavily weighted towards sourcing talent. I'm a little, I guess my surprise is that pre-boarding has such a low percentage, but not at all surprised in the stack ranking here. So, you know, Stanford team, 81% the audience feels sourcing talent is the biggest challenge, followed by pre-boarding and then the interview process. Could I just ask you to respond to the way the audience polled? Do you agree? Do you disagree? Where do you align or not to the response here?
This is Lynn. I think it matches probably what we're seeing at Stanford as well, that really finding new sources of talent and talent pipelines is really one of our major focuses.
Yeah, I think to echo Lynn too, yeah, the sourcing talent is a big piece, although we've been putting a lot of time and effort as well into the pre-boarding side of the equation, and as far as making sure that we can get our candidates across the line and into our centers and our locations.
And to add what Jenna said, I think interview and any opportunities we have to decrease the amount of time it takes to get through that process. He who gets to the candidate first typically wins. So we're making efforts in that space as well. So I do feel all three are important.
Awesome, thank you. And Angelina, if you wouldn't mind just taking down the poll so we can get back to the video. Perfect, thank you. All right, so with all of that being said, let's talk about ways to get smarter about how you recruit and retain your workforce. So specific to sourcing candidates and keeping those pipelines plentiful, do you have any strategies that you've deployed that have worked, and maybe even some that you've deployed that haven't been so successful? If you could share some of that with the audience.
Yeah, Courtney, I'm gonna jump to you. Courtney oversees both our sourcing function, but prior to leading sourcing, she also oversaw our TA strategy team and was a part of a number of the key initiatives they were driving to close some of these gaps. Courtney, some quick thoughts on some of the things we've been doing here to drive talent in.
Mm-hmm. Yeah, so one of the key ways we actually have our department set up a little segmented. So we actually have individuals working in event space, and we have individuals working in areas of marketing and advertising for recruitment, and we have individuals that are more of headhunters is what you could call them. So they're very specialized within a specialized function, and it's able to provide candidates a better experience because we're able to provide that nurturing relationship building that really needs to take place in sourcing to be effective. In order to do that, because candidates have so many options nowadays, it's really who can build the trust with them and encourage them to come work for our organization because we believe in the organization as well. I would also say, John, you want me to touch on second chances, or would you like?
Sure, yeah.
Okay. Another piece that we like to do within sourcing is bring in a strategic function as well. So being able to build out tactical plans in order to fill positions. So diving in, looking at the position itself, and then coming up with more of the strategic approaches. Second chances is one that I would say I'm very excited for, and I know others on the team are too, but it allows individuals that may have backgrounds that we can bring them in to say, we know you may have some different walks of life, but we'll help you and get you coached up to the next round. So being able to provide again, that relationship building to say, we'll walk you through how to build out a resume, how to interview, and how to really set yourself up for success to land a position within our organization. And also we've seen others go to other organizations too, but I think it's a fulfillment factor that we're able to be a part of in that candidate's life and their walk in their career path too.
Yeah, and a part of that, right? I was going to say a part of that as well is in around, really taking a hard look at our, background check matrix and things like that, and determining, hey, where are we drawing really hard lines today, where we can step back and look at, kind of the whole person, what they bring to the table. Certainly paying very close attention to, certain legislative needs that we need to meet in terms of making sure that we're not putting people through and into certain positions that would put us in violation of kind of being in code, if you will. But looking for how can we be better community citizens and try to help the communities we operate in get closer to full employment, and putting some of those that are in kind of at-risk pools, helping them create a pathway into our organization. So that's been a big thing. The other thing that I think we probably also need to touch on, and Michael, maybe you want to build on this one a little bit, is we've put a great deal of investment into international recruiting as well, knowing that we at the end of the day, there's a finite number of nurses in particular that you can get out of the university systems here in the United States, and there's obviously a huge supply and demand problem. We've decided we are no longer going to stay within the borders of our country to recruit talent. And Michael, you probably give it a little bit more on that.
Sure. So yeah, and that's one of those long-term pipeline building strategies that we've targeted to find new opportunities to bring people into the organization. So just for those in the healthcare space, if that's a strategy that is not being deployed at your organization today, it's something that you'd want to certainly think about. It can take a little while too to develop the right partnerships, the right process in place to make that happen. We've actually used a couple different avenues for international recruiting, everything from like a contract to hire approach to some direct recruiting through one agency. So we had some issues there, so then we switched to a different agency. So we're on kind of our third phase of international recruiting, and this is where it's really started to take flight. And we've been able to hone in that process with an international legal partner that really knows the international space to help process people through. So we've got a couple different partnerships in place, but right now we're targeting just over 850 RNs to bring them into the United States, to bring them to our organization. And then ultimately what we want to look at is where else can we expand? So we have conversations beyond just the RN space as well, into, are there other opportunities for allied health roles? We've got some conversations happening for clinical support roles. So, the international pipeline is something that we recently went deep into, I would say in the last year and a half or so.
And to the point made earlier about entry-level positions being, maybe the biggest disparity in supply versus demand, and being able to fill those pipelines of talent. Can you speak to that for a moment in terms of what strategies you've implemented that have been the most effective to build that pipeline of entry level?
John, I can snag this one real quick, just to talk about the rapid hire process that we implemented, which I'm sure many organizations out there actually did. So in the initial swipe at this was to remove the hiring manager from the hiring process and just have the talent advisor do the interview, make the offer, hire the candidate. We got some resistance from operations, and we modified that process to where now it basically, we contact the candidate as a talent advisor, we screen the candidate, we automatically schedule that candidate on the hiring leader's calendar, and oftentimes are hiring people within 20 hours. So it's a quick process, it's turning people around. Again, I shared earlier, those who get to the candidate first quickly get the candidate, and we're seeing some success with that.
Yeah, we were just talking today. We had a leadership meeting shortly before this with all of the kind of TA leaders, our supervisors, our leads as well. And one of the things we were celebrating was 2021 and the kind of numbers that we were able to achieve. We actually saw an 18% decline during 21 in the number of applicants that we received, kind of year over year in a comparison, but we actually hired or made offers to 10% more. And so, if you will, really, making sure that every candidate counts, making sure that we get one of my favorite phrases is getting more juice out of every squeeze. And so, we put up the most hires we ever have in a single year, in a year where we were down almost 20% in our applicant flow.
Wow. And I've heard a theme here in this section. I've heard comments on relationship building and getting to the candidate first. So when does the relationship building start, and how, I mean, along those lines, it's kind of the same question, but how do you get to the candidate first?
I can touch on that briefly. So I would say that the relationship builds with the brand, and it starts with the brand out in the marketplace. So we've Courtney talked a little bit about how we've got like a specific recruitment marketing type function within our sourcing division to put our positions out there, to start building those relationships electronically. So that's one way that we do that, is really just how we represent ourselves out in the marketplace. That's coupled with the patient side of things as well, right? How do we treat our patients, the experiences that you've had with our organization over the years? That's where I would say that relationship begins. But then when it comes and transitions into the recruiting process, one of the things that we've been focused on is reducing the barriers to entry. And I'm sure there's a lot of organizations that have focused very much on like, what can I eliminate from my job application process to make this easier? The less clicks, the better. I think we've gone one step farther than most, and we've actually partnered again with another entity that has helped us take our application process and move it out of our systems and instead put it elsewhere. And what I mean by that is, so for example, Indeed, one of the largest platforms for talent searches, we've actually made it so then you can apply on Indeed, and that just funnels through automatically into our applicant tracking system. They never have to leave the Indeed site. And there are, lots of companies, again, that do that in terms of like, they can go post a job on Indeed and then they apply on Indeed and then they have to go screen on Indeed. I would say the thing that we're doing a little bit uniquely is we're not requiring people to do another application to actually get them into our applicant tracking system. Instead, we've automated that entire process to pull from wherever their experience is directly into our system, so we don't have to ask the questions again or have them take additional steps.
Do you have any statistics by chance? Not to put you on the spot with this, if you don't, it's okay, but do you have any statistics in terms of how that has potentially increased any ROI and how that's increased your applicant pool?
Yeah, we actually just deployed that. John told you that we were down 20% applicant flow last year, and that was eating at us quite drastically. So we deployed that just after Thanksgiving of last year. Prior to Thanksgiving of last year, we were running, for us, it's 2,600 applicants per week as an organization. And what we've seen since we've deployed that solution, we've seen a 15% lift on average in applicant flow. So, you think about those incremental improvements that you can make. This one was actually a pretty big step forward for us to eliminate that barrier. And we're doing that. We've got other things kind of on our roadmap of how we continue to, build that into every experience that we have with candidates. We go to them instead of having them come to us.
Yeah, we achieved some of our best, kind of applicant flow weeks, literally amidst the holidays, and that doesn't, I'm sure, fall on deaf ears, for people that are on this call, and that those are usually the hardest time to get applicants. And we got some of our best applicant flow for the entire year. And in fact, probably an entire 24-month cycle during that time frame. So and that's continued into 22 here. We're continuing to see similar applicant volumes continue as we press forward. And to Michael's point, like, we're not satisfied with that 15% rise, right? We're trying to go after another 15% rise next. So figuring out what it's going to take to get there.
How important are social networks or referral type programs to your sourcing talent strategy?
I can take this one. So I'd say they're huge. We're constantly asking individuals if they know of someone that would like to join the organization. We're taking referrals ourselves as far as we're getting out. I know members of my team usually carry around something with them and are pitching it while they're at restaurants and those kind of things too. But we do have an employee referral program as well that's set up. And I know it's been a very huge part of bringing candidate pools in. And usually, if you enjoy working at your position, it should be an easy thing to be able to refer someone in. It's just being able to promote that within an organization that we do it.
Mm-hmm. And, we've talked a little bit about competitive pressures, wages, perhaps even fewer barriers to apply or in the pre-boarding process because they're not healthcare. So maybe just for a moment here, could you talk about how you're combating that? If you've been able to find any creative techniques to keep your applicant pools growing amidst the competitive pressures.
Yeah. So as I think about one of the things you're talking about there, how do you make sure that the people you get into the pipeline you can pull all the way through?
Right.
Really gets to something that Amanda and her team have been focused on in terms of what we refer to as kind of a concierge onboarding approach. Amanda, you want to touch on that real quick?
Sure. Yeah. To John's point, it's, once you have them in the pipeline, you don't want to let them go, right? Like, we want to get them across the line. And one thing we've deployed here recently is something we call concierge onboarding. And what that is we're meeting people where they're at. If someone needs help getting through the process, we're there to help them, to the level of everything, or to the level of, what, they've got it. They don't actually need our help that much, but we're there for every single person to make sure that we're walking them through, kind of hand in hand through that process. And, in addition to that, we've tried to remove wasteful things in the process that are maybe a nice to have versus a need to have, and established what those things are and said, you know what, we want to get them in the door and we don't want to make this overly complicated. And so what we're trying to do is reduce those parts of pre-boarding that we don't necessarily need to have before they're in our doors. Maybe we still need them, but we're doing that when they're here. They're getting paid for it. They're doing it within their department. So those are some of the things that we've tried to really manage through to try to get applicants to get through the process quicker, so that if we are competing, against the Chick-fil-A next door, that we're able to meet that same time frame, even though that gets harder when, you're competing against an organization that doesn't have a background, check, or maybe doesn't do a drug screen, or some of those things that can take a little bit longer.
So, I think you just transitioned us to the pre-boarding topic, Amanda, which is perfect. So let's stay there a moment longer. You're talking about ways to keep people from dropping out of the pre-boarding process. Maybe just hone in on how your organization, how your strategies have been able to put speed in the pre-boarding process. What have you done to speed up that process, which goes hand in hand with dropout, I suppose, right?
Yeah, it absolutely does. Certainly, having made sure that our new employees are educated about that process, and that is really the concept of concierge, is to make sure they understand what is expected of them, so that they don't miss parts of the process, delay that start date. We've also partnered really closely with Sterling, obviously, to make sure that we've been able to leverage the system to do things like custom workflows. So John mentioned earlier, we're in 24 states. So we have a lot of state-specific requirements as it relates to background studies and fingerprinting process that we need to make sure we're complying with. And with that being said, we've utilized custom workflows in Sterling to leverage the ability to collect information, whether it's Sterling running that check, or if, let's just say, the state doesn't allow a third-party vendor in to run a check, we collect the information through Sterling and leverage those custom workflows to get the information, and then we run those checks on our own. It's a simpler, quicker process versus having to rely on another system or having to rely on an email process. So it's easier for our candidates, it's smoother, we get it quicker, we can run them through more efficiently and get them, you know, across the line much quicker that way too. We've also partnered really closely with you know, our Sterling account manager to identify areas where we find jurisdictions that really we're at the mercy of the courts when we talk about background checks, but finding where there are jurisdictions that are running much slower. And so partnering to find out why they're running slower. Is it because they're not there's no virtual ability to get information, and so partnering with Sterling to be able to set jurisdictions up to get that, especially if it's a jurisdiction that we are, you know, using a lot, and there's a lot of employees that we're bringing in using that jurisdiction. So we're able to partner really closely that way, and then we don't run into those same types of barriers because they're ultimately removed by finding out what that root cause is. We've certainly tried to address, and we've put together some task force around our pre-boarding process to really look at every little point in the process to identify where can we find data around where we're getting slowed up or where people are getting stuck in the process. And then as we've been able to identify where we find that stuck spot for individuals, been able to try to then remove any barriers that we have for candidates, but then also from our hiring managers and our offer process as it relates to approvals. Maybe it's taking a long time to get through offer approvals, or we have to lift it up through a certain approval process, and trying to, again, remove the barriers to having that process take longer. And so really any waste in that process, we're trying to reduce that so that we can get people across the line as quick as possible.
Do you have any examples of maybe where you found some waste that you've been able to reduce?
Yep, I can talk about that offer process a little bit, where we've identified that our approval process is what really takes the longest in our offer process. It's not our talent advisors, you know, getting the information. It's not our talent advisors getting the offer out to the individual to be able to extend. It's really internally where we have an approval process in place that requires us to get certain approvals for certain wages. And that's really where we're getting hung up by a certain number of days. And so we're saying, if we are never not approving them, right? Like we're always approving them. There's never an instance where we're not. Why don't we remove that approval? There's no use of it if we're never saying no, right? So that's maybe one example where we're trying to remove that so we can get people through the offer process and then further on through the pre-boarding.
Yeah, and a couple of other things that come to mind as well, just in terms of Amanda's world, and some of the things they've done as well is they've streamlined. You know, in the past we used to have you know, employees come to one location to complete certain employment paperwork, and then went to a different location to do their employee health appointment that they needed to do to, you know, get the necessary titers done, you know, to make sure they did the drug screen, all those types of things. We've now co-located our talent with the employee health team, so it's a one appointment location. You know, so really streamlining for the candidate, making it simple for those to be able to get in and get out in a single appointment in close proximity to each other. And then the other thing, just it's a constant, continuous improvement thing. As a matter of fact, Thursday, Friday this week, Amanda's leading a Kaizen event, which is a lean process improvement event, looking again at how can we get even better than we are now to make the onboarding process even that much more smooth than it is today.
From a perspective of adjudication, you were talking about eliminating waste, but also from the perspective of adjudication, I find that that is actually an area that a lot of organizations end up spending time and cycles in, and you could lose the candidate, right? And can you just talk a little bit about your adjudication process? I know you partner with Sterling, and we've supported you in that process, but in that and beyond that, could you just talk a little bit about how you've been so successful in moving through that final stage so quickly? Because it really is quite impressive. And from a benchmark standpoint, really often this is very low-hanging fruit for a lot of organizations to improve the adjudication part in the pre-boarding process.
Yeah, well, you hit the nail on the head. We've partnered with Sterling to leverage the system, certainly to be able to put in automated adjudication. So we put specific criteria into the system so we can auto adjudicate out whatever we need to within reason, obviously. And then we do have what we call a background check governance committee. So when something comes back and it's in review, we make sure that we run them through that process quickly. We have SLAs that we leverage or use around that. And then the other component of that is we've gone to a contingent background check process. So what that means is that when we get hung up by a county jurisdiction where it's taking weeks and weeks to do that check, and we're waiting and waiting for the county, and we're really at the mercy of that jurisdiction, we've put in place what we refer to as a contingent background check process, where we have an approval process that we can take a look at what we have and say, wow, there's just this one county hanging out there. Everything else looks really positive on this background check. We're going to allow them to start contingently. They'll sign off on that, of course, through our offer process, but we'll allow them to start contingently, continue to run that report on the back end because it's either unperformable or extremely delayed. And then that way we're not hanging up that person from stepping foot indoor. However, everything on the surface looks really good, and then we'll run that out on the back end and obviously continue to validate, and if something comes up, address. However, that has been something that has certainly helped us on the clinical side of our hiring, but we've recently implemented on our non-clinical side too, because we were seeing that happen quite a bit on some of those more entry-level positions that, again, are really hard to fill, and once we have them, we need to get them through the process really quickly.
Yeah, and
So
let me add one more thing to what Amanda just said is the the approval, the ability to do that with clinical staff was something we did amidst incident command via during COVID, right? It was really a COVID-driven decision. We knew that certain jurisdictions were having problems with court runners and accessibility and getting the responses we needed in a timely way, and wanted to have a protocol for how we'd manage that for clinical folks. Well, not surprising, we were running into the same walls with non-clinical and escalated that accordingly via incident command not so long ago. And now really across the organization, we have the ability to do these contingent background check starts based upon a number of different criteria that Amanda and her team helped set up. But more importantly, we stepped back recently and said, is it really COVID that's driving this now, or is this have we reached a new day, right? And do we think this is the foreseeable future? And actually have just gone through the process of changing policy here at Sanford to make this part of our norm and not something that would ever require incident command approval in the future.
Mm-hmm. And in terms of workflows, you both touched on workflows, Amanda more directly on automation, but John, what you were talking about, I want to say from my own knowledge and conversations with you, there's some automation in there in terms of how you're workflowing things through all aspects of the talent life cycle. How is Sanford leveraging technology to better work stream its processes? And we don't have to stay just on pre-boarding. You can cover any aspect of sourcing talent all the way through to day one.
Yeah, well, I think Michael started to touch on it. I mean, we're using it all the way up at the front end of the apply process, right? How do we make it so that the application that somebody has sitting on Indeed is sufficient to flow right into Workday, right? How do we make it so that something sitting on ZipRecruiter can flow right in? I think other things that we're in the midst of doing, are simplification of the application process that would allow people to apply via text. People to be able to, interact with a artificial intelligence virtual recruiter and through, kind of a conversational interaction, be able to complete an employment application, express interest in given opportunities, and get us in touch with people who, maybe aren't fully ready to apply, but they're willing to give enough information that allows our sourcing team to be able to reach out and build that relationship that Courtney was talking about, and pull them through to the application phase. So I think those are a couple of key things. On the back end, Amanda, maybe you can speak just real quickly to how we're leveraging some other technologies like ServiceNow to better workflow things as well.
Yeah, thanks, John. We are using ServiceNow, which is a platform that traditionally we've used to create cases with our employee service center, but recognizing that there's some ability to really segment out tasks, and from a workload organization and from a workflow standpoint, we've been able to build some RPA from our ATS to be able to flow into ServiceNow. And what that allows us to do is really hold that information in that system, and those individuals that are responsible for that work, it really gives us a source of truth so we can work between teams to be able to have all of that information within the system, which provides us the ability to report out on that much easier, to be able to have visibility to it, and to be able to work closer between teams, versus the traditional, we've done it through either you write it down on paper and you give it to somebody, or you use a spreadsheet or something to that effect. It just provides us a much better technology to be able to have that information in one spot. And we've partnered really closely with our HRIS teams to be able to build that out. It's not the traditional way you use ServiceNow, and so we really recognize that this is something that we've built into that system. But it is something that it has moved us forward as far as organizing that work.
Awesome. And so I was just catching a note from Angelina that we have some questions. So I think that, Amanda, that's a good pause and a transition to Q&A. Angelina, do you want to come on and surface those questions for us?
Absolutely. So yes, we have a few questions coming in, and I'm just going to start with when they came in and go through there. So one of the questions was, does a lower volume of candidates mean more colorful background check results on those candidates that you're getting to apply?
Amanda, you want to take that one?
And Angelina, did you say a lower candidate volume result in lower candidate, or can you repeat the question? I apologize.
Yes.
I want to make sure I'm understanding.
Does a lower volume of candidates mean more colorful background check results on those candidates that you are getting to apply?
I would not say we've seen an increase in what that looks like compared to previous. No. I would say we haven't seen an increase in adjudications. We haven't necessarily seen an increase in those that don't start work with us due to maybe not passing that background check. That's been pretty level for us, at least.
Mm-hmm.
Yeah, just maybe piggyback off that, I would say with some of the pieces that we've put into place, while we have a lower applicant volume, I feel like we've had a more qualified applicant volume come through, which has really helped to not have that more colorful background check.
Yeah, Jenna, that's actually a really good call out, and something we probably glossed over in terms of another step in the apply process that simplified things is we got real transparent with pay this past year, right? So in posting at minimum, kind of what's our minimum pay rate? In some instances right now, we're starting to pilot posting full ranges from min to max. And so we're testing different things, but ultimately, with that, to that end, right, we got perhaps a slightly better quality pool because the people that were applying knew, kind of roughly what the range was going to be, and we weren't getting into conversations early and finding out that pay is not going to work.
One thing that I'll just add on, just for the audience perspective, when we made that shift, that was in response to our lower applicant volume too. So what we saw is the trend of our applicant volumes going down, and we said, well, maybe if we become pay transparent and we should show, yes, this is your next step for your career, that maybe that would move us in terms of the number of applicants that we had. So I just want to make sure that people didn't hear anything around pay transparent, and then we had lower applicant flow last year, but it was actually in response to the lower applicant flow.
Thank you, everyone. And we did get a couple of questions around international hiring. So I'll just kind of combine those both together. The first being, where are you finding the pipeline of international RNs, as well as any feedback or suggestions on international recruitment once you get to the interview phase?
Yeah, so we partner with a third party, so we're relying on international recruiting professionals to handle that volume, to find the talent. When they're searching, though, they're searching globally. So one of the things that we talk about is, like, we aren't targeting a specific country for international recruiting. We're opening the doors to all facets of nationality for where are people coming from to join into our pipeline. So I can't say that we're targeting a specific area, but we partner with a firm that can be a global player. So I'd say that was probably the biggest thing for us that's helped us be successful, is to not rely on one given country. In terms of getting to that offer stage, I mean, you have to know that legal process very well, right? From making sure that your wages meet the governmental requirements, and you have to do that legwork well ahead of time, because those government processes have been impacted with tremendous slowdowns. It takes six plus months to get feedback on rates of pay that we have to publish out in the marketplace before we can do the international hiring and do those offers. So from knowing that front end piece of the process, and then once you actually have an accepted offer, making sure your business, making sure your operations team understands that just starts the immigration process, right? Like now they have a job lined up. There's still a lot of road ahead for that to actually come through and those individuals to actually show up. We're experiencing about 12-ish months from offer accept to when somebody's actually showing up. So those timelines require people to be forward thinking. It can't be I have pain today, how do I solve my pain today, in terms of staffing, but it's I've got this pain today, we've got to have some short-term solutions, but what's our long-term plan, and how are we going to combat that in the long term? And you have to make sure that everybody involved is on board with it.
Mm-hmm. Thank you. And then we also got a couple of questions around that Indeed example mentioned earlier. Both of those being, regarding that Indeed partnership example, what ATS did you use or do you use? Followed by, how do you collect the EEO info through that Indeed apply?
Yeah, so we use Workday as our ATS. And I'm guessing many people are saying, well, how can you pull that off with Workday? Because Workday is a little bit restrictive on what to accept. So we found a company that has a relationship with Workday, has prior Workday engineers on their staff that know how to effectively build an integration in between our Workday system and Indeed system. And so we actually then export all of our questions that we typically have in our Workday apply process directly into the Indeed apply process. So those two, they're the exact same set of questions. It's the same experience, except they just never have to leave the Indeed site. So we get all of our EEO information during that initial apply process as well. So we've customized that Indeed Easy Apply to meet our organizational needs. We're just doing it there instead of transitioning them from Indeed into our Workday apply process.
Mm-hmm. Great.
Those are all the questions, Angelina?
Yes, as of now.
Okay. So I think that is bringing us close to the closing here, but just one question that kind of gets us thinking about the future. I don't think any of us have a crystal ball, but one thing we are told by experts is that this staffing shortage in healthcare is not going away. But do you see any shifts in terms of the roles that are tough to fill, or sourcing techniques? Any shifts for the future, or just more of the same?
Yeah, I'll start, but I think probably everybody on the phone, everybody on this WebEx probably has a point of view on this. But one, I don't think things are going to get better, right? I think we're going to continue to see the spaces where we've had challenges today be challenges tomorrow, both from a entry level perspective. I think that's going to be a problem for the foreseeable future, especially in healthcare. Michael spoke to some of the barriers that exist where we can't raise wages to the same extent that for-profit can, and that creates challenges in terms of reimbursement and being able to keep your organization financially sound. But I do think you're going to continue to see issues with the supply demand shortages, and you're going to need longer term strategies that are going to close those gaps. Whether that's an international strategy, whether that's a community build strategy, where how can you get more people within your community engaged and interested in healthcare, right? We're recruiting at the K through 12 level and legitimately down to the kindergarten level, right? Where we're in classrooms, we're doing interactive exercises with students. We're introducing them to healthcare. We're introducing them to our labs, things like that, and literally pulling them through over time, doing high school, internships, and then on into even sponsoring their education at tech schools, sponsoring their educations at colleges, in order to pull them through. And I think that's a necessary part of this as well. Is there's getting more and more of the populace interested in the healthcare space will be a big piece of this, in addition to some of the other things we spoke to. But any other perspective on that?
I can jump in here. I think it's really about abandoning the fixed ideas, right? I think you have to think about how to do it instead of why we can't do it. And I think in the past it may have been, oh, we've got all these other priorities. Well, this is a huge priority, and I think it's really about being creative and not losing sight of that, and being really open to change, because that's just the world we live in right now.
To Amanda's point.
Go ahead, John.
To Amanda's point, I think we used to do a really good job of screening candidates out, and now we need to do a really good job of figuring out how to screen candidates in. So that's going to take a huge mind shift. We're seeing that from hiring leaders right now that maybe look at a spotty resume that, hey, this person looks like a job hopper. Well, that's more prevalent now than it ever has been. So needing to have those conversations with leaders to take a chance, if you will, on the candidates that we're getting.
I think the other thing that we encourage our team members to do is the ideation piece. So we're sharing thoughts and ideas. We have forms that our employees can fill out to bring forward new ideas on a daily basis. There's not a limit to how many ideas they can bring forward. I would say we've acted on the majority of those ideas brought forward, and I think that helps stem just new creation and new life into the recruitment process.
That's all great. And my 5-year-old daughter has told me she wants to be a doctor, and she's been on this kick for a little while. So I will send her your way, John, and you can enter her in your pipeline.
Excellent.
Jen, the only other thing that I would kind of add to the conversation would be, thinking about what are the threats to your organization for somebody stealing those talent away, and how do you do the exact same thing or do it better? So, one of the ones that I like to think about is when like Uber and Lyft came and kind of really disrupted the taxi industry. And so, we're experiencing that from all angles, whether it be non-healthcare entities and what they're able to offer to people different than what we can do in healthcare, to the move for people going to travelers. So we're trying to figure out what pieces of that do we want to enter into to directly compete or to exceed the expectations of staff in being what they want us to be from an employer perspective. Everybody wants more flexibility, more pay, more experience. And so we're trying to think creatively instead of focusing in what many other people talked about, right? Like instead of focusing in on here's what we do today, let's keep doing the same thing. The problems really have not shifted drastically in terms of like what people are looking for, but we need to adapt drastically because the candidate pool has changed to meet more of those needs. And so we continue to try and evolve with the marketplace.
And correct me if I heard you wrong here, but I think what you're saying is there is a need to get more creative with like some gig strategy, basically to meet the demands of the marketplace who wants flexible pay, maybe even higher wages, things like that.
Yeah, we expect that to be the next big disruption. Absolutely, in healthcare.
Well, I guess that might be our next webinar topic. Stay tuned. Everyone, thank you so much. We really appreciate you joining us, to the Sanford team and to the audience. Some notes that I took for myself as I was listening to our panel of experts here is, in terms of sourcing, it's really about relationship building, starting early. Kindergarten is not too young. And getting to the candidate first. You need to diversify your candidate population. So be that second chances, be that international, open up your applicant pool, hire people in, don't hire people out. I heard you say toward the end there, Jonathan. And then in terms of getting people through the pre-boarding process, in summary, some of the main takeaways I heard were eliminating waste wherever you can, leverage automation on repeatable processes or just things that we don't need humans to do, because you can push someone through the workflow more quickly and effectively. Concierge services is huge. I think it's amazing that you all are doing that. I have some other customers that I've connected with that are doing that, but a lot of organizations just don't have the bandwidth to do it or know how to. So Sterling as your partner can certainly help. We've done some work in that space with our clients to provide those concierge services as well. All in all, it sounds like the future holds much of the same. So get your strategies right. Don't be afraid to try, get creative, and find a way to do something new. Don't focus on the fact that it hasn't been done before, so it can't be done going forward, because there's a way. I hope that was good in sum. Again, thank you so much, and audience, thank you. Please remember you can earn professional credits for this webinar through SHRM, and we'll follow up to let you know how to do that. All right, thank you so much, everyone.
Thank you.